phalanges of the fingers, right? And the reason why I told you to do that is because I wanted you to sort of develop a mental picture of how the bones fit together, right? Because how are you going to be tested on these bones and bone features? Well, you'll come to a station in lab. There'll be a bone there sitting by itself, right? There's a little piece of tape on it, maybe a piece of tape on some of these bridges here, maybe here, right? And there'll be a little card with questions, like name this bone, name this bump, name this depression, that sort of thing. And you've got to be able to visualize where this bone fits on the skeleton in order to answer those questions, right? And that may seem hard at first, but if you use the approach that I'm going to show you, right, you'll actually be surprised at how quickly you can actually pick up, learn the skeleton. And the approach takes you through the bones of the appendicular skeleton, starting here at the girdle and working your way down to the fingers, putting together the bones in as they would be on an articulated skeleton such as this, so that you can start seeing how the bones fit together in your mind's eye. Okay? Alrighty, so we're going to start here at the pectoral girdle, and if you turn to the second page of your study guide, you'll notice I actually listed the bones in that order, starting here, working your way down to the phalanges. Okay? Alrighty, so the first bones we're going to look at are the clavicles, or what you know as your collarbone, right? And there are only two structures on the clavicle that you need to know. By the way, the pectoral girdle includes the clavicle and the scapula. The scapula is your shoulder blade, clavicle is your collarbone, right? There are just two structures you need to know, or two regions, I should say, of the bone that you have to know on the clavicle. You have to identify it as the clavicle, and then there is the medial side, and then there is the lateral side. The medial side is also called the sternal end because it articulates with the sternum. This is your sternum or breastbone. And you also have the lateral side, or a acromial end, lateral end or acromial end, because it articulates with the acromion of the scapula. It does not matter to me which one you use, a lateral or acromial end, sternal or medial end. Either one is fine.
Acromial might be easier
now,
because the acromial process.
Notice that one end is enlarged and blunt, and the other end is flat. The end that's enlarged and blunt is the medial or sternal end, right? You can see that right here on Scully here. And you can also feel that on your whole body, right? You can feel where the clavicle articulates with the sternum on your own body. Whenever you can feel it on a bone or bone feature on your own body, right, the better. Okay, so feel it. So whenever possible, palpate it on your own body. Don't palpate it on anybody else's, but palpate it on your own body. Okay, so this is the sternal or medial end. This is the acromial or lateral end. Okay, and that's all you have to know for the clavicle. Next bone are the scapulas. All right, now you want to put the scapula in correct anatomical position. Now, obviously, this surface here is going to have to face laterally, right? Because it's going to articulate with the humerus. So the only question is this correct anatomical position, or is this correct anatomical position? All right, how do you know? Well, find something that speaks to you that says, hey, this is correct anatomical position, hey, this is the anterior side, hey, this is the posterior side. Now, some people realize that this is called the spine of the scapula, right? And you've seen enough people's backs with their shirts off, and you probably realize you can see this underneath the skin, right? So some people will say, well, use this and say, hey, I know this is the posterior side, right? So this has to be correct anatomical position, right? If that works for you, use it, right? What I use, and you don't have to use it, I use whatever works for you, but what sort of spoke to me was this little structure right here, which is called a coracoid process. And you have to know it anyway, so why not use it? It reminded me of a little finger pointing away from the body, right? Almost like the scapulas were doing like a little dance, right? So that's what I use. All right? So if I'm walking down the street and I pick up a scapula, right? I can put it in correct
You're gonna find that on the
position
street somewhere.
just like that, because I know that the finger has to point, or the coracoid process has to point away from the body. So that's what I use. Like, use whatever works for you. Okay, that's what works for me, but use whatever works for you. After you put this in correct anatomical position, that is half the battle. Because this is then the medial border, this is the lateral border, this is the superior border, right? All you have to know is what's superior, what's lateral, what's medial, which you should know already. Right? If you don't know that, right, this is you're in trouble. Okay? After that, all you need to know then is the acromion here. Remember the acromial end of the clavicle, right? The acromion, remember that part on your shoulder? The acromion is the highest point on your shoulder, right? That's where the sternum articulates with the acromion of the clavicle. This surface here is called the glenoid fossa. Right? The glenoid fossa. A fossa is a depression and an articulation. I tell students remember fossa, remembering Mufasa from the Lion King. So I said, fossa. Ooh. Say it again.
Fossa.
Fossa. Right. I have students years after they take this course, they remember that. Fossa. Ooh. Okay? You also have the glenoid cavity. Now, let me contrast glenoid fossa and glenoid cavity. Glenoid fossa is the actual surface, right? Bones, at least in the synovial joints, which is what this is, they do not contact one another. If they did, every time you moved, you'd be in excruciating pain, right? There's a space filled with fluid between them. That space here is called the glenoid cavity. So if I were to ask you to name the space, it'd be glenoid cavity. If I ask you to name the surface, it'll be glenoid fossa. Okay? Alrighty, and that's all for the scapula. Next is the humerus. You have one bone in your arm here, the humerus, and of course the head of the humerus has got to face medial, right? It wouldn't make any sense for it to face lateral. Right? So the only question you have is this correct anatomical position, or is this correct anatomical position? All right. How do you know? All right. Find something again. Find something that speaks to you.
The groove at the bottom,
Okay.
right?
Some students will focus here
Where your elbow
at the
has
joint, right? And they sort of have an idea of what your elbow sort of looks like, and they'll say, well, you know, I have that big protrusion right there, so this has to be the medial. Well, you know this is the medial side anyway, because of this, right? Excuse me. Sometimes they'll look at, you know, these grooves here and have an idea, well, you know, it bends that way, you know, that sort of makes sense. That this never worked for me, by the way. Right? I always had to find something else. Okay, but if there's something down here that speaks to you, that you know which side is anterior, which side is posterior, use it. What I realized when I was first studying these bones was that the anterior side and the posterior side look a lot different. You've got these two rather obvious bumps here, processes, right? Projection, the process of projection, by the way, called tubercles. And again, you have to know them anyway. Why not use them? You have the greater tubercle and you have the lesser tubercle. And you don't have those bumps on the posterior side, only on the anterior side. So that's what I use. I look for those tubercles. When I find them, I know, okay, that's the anterior side, so this is correct anatomical position. All right, so that's what I use. Okay? Once you have it in correct anatomical position, half the battle. Right? So head of the humerus, greater and lesser tubercle. You also have this raised ridge here on the lateral side of this bone called the deltoid tuberosity. All right? Do you know where your deltoid muscle is?
In the back.
It's what? Well, it's actually all around. It basically makes up the round part of your shoulder. Right? That is the deltoid. One of the actions that your deltoid muscle is responsible for is abducting the arm. Right? Like you're going to do a jumping jack. Right? Or if you're going to do a plie.
Let's see.
Right? Okay? And muscles pull, they never push. Okay, the way muscles work, they always pull. Right? So imagine your deltoid muscle here pulling on the humerus to raise your arm, because that's what it does. Right? Where would it attach? It would attach right here at that deltoid tuberosity. That's why it's called the deltoid tuberosity. Okay? Now you don't have to know that. I tell you that so you can sort of make sense of, well, why is this called the deltoid tuberosity and why is it here? Right? Versus just memorize this deltoid tuberosity, okay? Right? You have some meaning behind it. It's easy, again, you're understanding and learning as opposed to just memorizing. Okay? So that little raised rough area is the deltoid tuberosity. Tuberosity is a projection where you have a ligament or a tendon attaching to the bone. Okay? Alright, so that's everything in the proximal end of the humerus. Now let's move to the distal end of the humerus. You have these two projections here called epicondyles. Epicondyles. Right? You have the medial epicondyle, which is why it's important to put this in correct anatomical position, and you have the lateral condyle. Lateral epicondyle, excuse me. And you can find these on your elbow. Right? If you get to your elbow, those two protrusions, one on the medial side, one on the lateral side, those are it. Those are the epicondyles. The medial epicondyle specifically is called your funny bone, right? Because when you hit that, you have that, you get that tingling sensation, unlike a York peppermint patty, right? That runs up and down your arm, right? And that's because it protects the ulnar nerve, and so when you hit it, you traumatize that ulnar nerve, and you get that tingling sensation, right? So that's medial and lateral epicondyles. You also have a little groove here called the coronoid fossa. On the anterior side. On the posterior side, you have the olecranon fossa. All right. Okay. Now you don't have to know this, but this little this little condyle here is called the trochlea, and you'll understand why it's called the trochlea in a second, or why I'm telling you this, although you don't have to know it in a second. Okay, so that's it for the humerus. You have two bones which make up your forearm: the radius and the ulna. Let's talk about the ulna first. Ulna, one of the easiest bones to identify. What letter does the ulna begin with?
What?
What letter does the ulna begin with?
U.
U. Check it out.
It's a U shape.
The funk soul rubber. See that U? Right? Makes it really easy to ID. Alright? So ulna. Okay? The ulna is if you're in correct anatomical position, the ulna is the medial bone. Alright? And an easy way to remember that the ulna is the medial bone is when you're in correct anatomical position, the ulna, which begins with U, touches the underpants. Right? So think ulna, underpants. Okay? Alrighty. So let's talk about the ulna. What do you need to know on the ulna? Well, this surface is called the trochlear notch, and it fits around the trochlea. That's why I identified the trochlea. Right? So you understand why is it called the trochlear notch? Because it fits around the trochlea. Right? This projection right here is called the coronoid process. And look, the coronoid process fits into the coronoid fossa. Okay? So now that list is getting shorter because now it's making sense. Right? Why it's important is you study these bones in context, not just randomly grab a bone and try to memorize it. Right? And this process or projection here is called the olecranon process, which, by the way, is your elbow. And the olecranon process fits into the olecranon fossa. Okay? After that, only two other things you have to know. This flat raised area here is called, well, not the styloid, the flat one part here is the head. That's the head of the ulna. And then this little projection here, which reminds me of like a cat's claw. Right? This is what it reminds me of. It's called the styloid process. And you can palpate that on your wrist, right? It's that on the medial side of your wrist. That's the styloid process of the ulna right there.
My fingers. What are the fingers of the
Okay.
Something on the right wrist. You know.
The lateral bone is the radius, right? Think
gotcha.
radiate out from the body. You know, something radiates out, right? It's projecting out, right? So that's how I remember that the lateral one is the lateral bone. Again, when you're in correct anatomical position, is the radius.
Radius. Okay, I like that.
You have the head of the radius. Notice that the head of the radius is proximal. The head of the ulna is distal. And again, you have a little raised, again, with structure which looks like a cat's claw, right? Another styloid process. And you can feel the styloid process on your wrist as well, right? It's the bump that's on the other side, on the lateral side. So both of those bumps are styloid processes. It's one of the ulna, one of the radius. Okay? Okay. Alrighty. This will be handy. Bones of the wrist are the carpals. Right? Remember that this is the carpal region, right? If you have people who have carpal tunnel syndrome,
I had carpal tunnel surgery.
They have pain here in the wrist. The carpal bones irritate. There's a nerve that runs through here called the median nerve that is irritated. So bones of the wrist are the carpals. The bones of the palm are the metacarpals. And then the bones which make up the fingers are called the phalanges. Singular is phalanx. So you have a distal, middle, and proximal phalanx on all of the fingers except for the thumb, where you just have a distal and a proximal. Right? So we just went through all of the bones and bone features that you have to know of the pectoral girdle and the bones of the upper appendage or appendages. Right? Now, what you're going to want to do is not sit down and do this at one sitting. Right? Start at the pectoral girdle and just do, maybe work on the clavicle and scapula for a little bit. Right? You want to use an articulated skeleton, your lab manual perhaps, to put the bones in correct anatomical position. Right? And just cover the clavicle and the scapula for a while. Right? Pointing to the bone features, saying them out loud. If you have problems pronouncing them and spelling them, write them out. Right? Remember back in elementary school how they teach you how to spell? Right? They had you say the words out loud and to write them. Right? That's how I did it. That's how I learned how to spell and pronounce many of these words. Okay? Do that and just again start with just clavicle, scapula, then clavicle, scapula, add maybe the proximal end of the humerus. And clavicle, scapula, proximal end of the humerus. Do that for a while till you get comfortable with that, and then add the distal end. Then add one of these bones. Then add the other, right? And then add the hand. Okay? Just taking little chunks at a time. And that repetition, right? That repetition will help you to learn the material. Right? Learning it just like you learned your ABC. Did you sit down all of a sudden one Friday after school and learn the alphabet A through Z? No. You learned A, B, C, D, E, F, G. Then you added H, I, J, K, L, N, O, P. Right? And then eventually you knew it all. Right? But you got to take it in little chunks. Right? And do that repetition thing. Right? A, B, C, D, E, F, G. Right? Then you go A, B, C, D, E, F, G, H, I, J, K, L, M, N, P. That repetition, you'll pick up on it just like that. If you take this approach, you'll be amazed at how quickly you will learn these bones and the bone features. Right? At first, you'll be into your looking at Scully here, and you'll be using your book quite a bit to make sure they're in correct anatomical position, all that kind of stuff. Eventually, you won't have to look at Scully anymore, or maybe after you lay them out, you'll check just to make sure, right? Right? But then eventually, if you do this enough times, you just lay them out just like I did. And this is when you know you have arrived, right? When you can put these bones together in your head. Right? You can study without actually having to break out the bones because you at least know what they look like and how they fit together. Right? You may forget a feature, right? Just like you may not know how to get somewhere, but you just can't remember the name of that street. You know what it looks like. You can tell, the name of a restaurant on it, but you just can't remember the name of it, right? Once you can do that, you're in good shape. Before I teach this class every semester, I'll sit down and I'll go through the bones, starting here, right? Just to make sure I haven't forgotten any of the features, because sometimes I do. Right? I mean, I can see them. I can see the feature, but I mean, what is that called? I just cannot think of it, right? But I can see it. All right? And then I look at, greater tubercle. That's right. Well, that's a tubercle. Okay? That's the approach you want to use, right? If you do that, by the time you've done this like 10 times, right, you'll be amazed at how much you know. Okay? So that's the upper portion. We'll run through the. All right. So now let's start at the pelvic girdle. So these are the bones.
I'm remembering the elephant last
right? These are the bones of the pelvic girdle, right? And for the longest time, I just had the hardest time putting these in correct anatomical position. It just looked so weird, right? I mean, it's just to visualize how they sit. Okay. One thing to keep in mind, this little rough area here is where the sacrum articulates, which is this. This is part of the axial skeleton, but it sits right here between the two, right? And that's easy way to identify the medial side. Right. One summer, when I was working with a student, he brought something to my attention. He said, "Well, if you put it in correct anatomical position, right, you can wear it like a mask."
Oh my God!
Right? And I said, "Well, yeah, but then it looks like you have your head up here." Well, whatever works for you. Edit that. Right. But nevertheless.
But that's a good way to remember.
Correct anatomical position. Right? It's about like this. Okay? This is commonly referred to as the hip bone. It's actually 3 bones fused together, right? You have the iliac bone or ilium. You can use either term. Remember that the iliac region, right? What I call it the elephant ear, because that's what it reminds me of. The elephant ear portion of the bone is the ilium or iliac bone. This posterior portion is the ischium, right? Sometimes it's referred to as the sit-down bone, because when you sit down, most of your weight falls right on that bone. Right? And fat pushy on the tushy. Is that what it is? Right?
No, not quite what we were saying, but.
Right. Okay. And when you sit down, like if you misjudge the distance or someone pulls the seat out from under you, go, ugh, right? That pain you feel is basically this bone, right? Traumatizing the tissue below it, right? The ischium or sit down bone, and then right here in the pubic area is the pubic bone, and the 2 pubic bones. Articulate here at what's called the pubic symphysis, and there's a little piece of cartilage, fibrocartilage that sits there. It's what's called a cartilaginous joint, making up the pubic symphysis. All right. Okay, let's talk about some bone features. Well, this ridge on the iliac bone is called the iliac crest. This large hole right here, any hole in the bone is called a foramen. This one specifically is called the obturator foramen, and it allows blood vessels and nerves to pass into the anterior thigh. There is also a little notch right here on the posterior side called the greater sciatic notch. Your sciatic nerve is this large nerve that descends into your posterior thigh. Right? So this is the greater sciatic notch. People who complain of who have sciaticas. Right? Oh, you have that? You typically complain of pain that runs down your posterior thigh or tingling, that sort of thing. Okay. What else? And lastly, This depression here, where the femur will articulate with the costal bone, is called the acetabulum. The acetabulum.
Pain in the acetabulum.
As in my A&P instructor's real pain in the acetabulum. Right? Don't abbreviate that when you say that. Acetabulum. Okay? Alrighty. The bones in the femoral region are called the femurs, right? And they are the largest bones in your body. Right? The largest bones in your body. Now, I used to mix the femurs and the tibias up all the time. The tibia is the large bone on your leg, right? And when I finally realized, okay, femur is in the femoral region, right? I never did that anymore. Right? It took me the longest time to actually make that connection. Femur, femoral, fellow. Right? So femur, femoral region. Okay? Now, obviously, the head of the femur is going to point medially. Right? But the question is that correct anatomical position? Or is this correct anatomical position? Right? Some students will say, well, look, obviously the knee bends posteriorly, right? So that doesn't make sense. Okay, when I was first learning the bones, I didn't like that. I had to find something else, right? If that works for you, by all means use it. What I noticed was the same thing I noticed on, the humerus, right? That we have these projections here that are different. You have a different view of them on the anterior side versus the posterior side. On the anterior side, you can see what are called, here we had tubercles, here we have trochanter's. Trochanter's are bigger and rougher, right? More gnarly. All right, what? And they're only found on the femur, okay? So instead of tubercles, we've got trochanter's. We've got the greater trochanter and the lesser trochanter. And what I noticed was if you're looking at the anterior side, you can barely see the lesser trochanter, right? In fact, to me, it looked like it was just peeking around the corner. I was afraid to come out. Right? So that's what I use. I use those trochanters. You have to identify them anyway, and why not use them? So, greater trochanter, lesser trochanter. If you're looking at the posterior side, remember that. That's the anterior side. Okay? So, head, neck, greater trochanter, lesser trochanter. The only other thing you have to know are these condyles here. And now that you have an incorrect anatomical position, you know that this is the lateral condyle, this is the medial condyle. Easy peasy, right? Your leg, and by the way, your leg technically is from your knee to your ankle, right? This is the thigh. Okay. You have the large bone in your leg is the tibia. Okay. Now, you probably have no problem identifying this as the anterior side, right? When you think of your knee, right, you think of a structure that looks like that. Okay, so that's not a problem. The question is that correct anatomical position or is that? Okay? Well, I'll give you a hint. This little projection here is called the medial malleolus. So
they're the other way around.
That has to be correct. Right? And the medial malleolus, by the way, is that protrusion right there that you've seen all your lives, probably taking some skin off of it from time to time. Right? That's what that is, right there. Medial malleolus. Okay? So, now we've got this in correct anatomical position. Here we had a lateral and medial, a medial and lateral condyle. Here we have a medial and lateral condyle. Okay? Easy. This is the tibial tuberosity. Tibial tuberosity. And really, this is what you skin. You know, when you skin your knee, you don't actually skin your knee. You really skin your tibial tuberosity when you really think about it. Right? Because that's what hits the ground. Right? Not your kneecap, really. Tibial tuberosity, medial malleolus. That's it. The lateral bone is the fibula. Right? And there's just two structures you have to know on the fibula. Opposite the medial malleolus, you have the lateral malleolus, and that's the other protrusion on the lateral side of your ankle. And then you have this enlarged, somewhat slanted surface here called the head of the fibula. Now, I used to mix these two up. In fact, I actually taught this backwards one time. Ooh, how embarrassing. Right? The head is more blunt and enlarged. The lateral malleolus is a little thinner and so longer, right? If you really compare the two, right? So that's how you can tell the difference between the two. Right? But that messed with me for a long time.
Lateral long 2 hours.
Right? And so they fit down on the, like so.
Okay.
All right, so that's those.
Over the top too.
Yeah. Just getting close to downtown. Okay. Alrighty. So let's look at the foot. Right. This large bone right here is called the talus, and the talus is where most of your weight comes down on the talus here. Right. And then your heel bone here is called the calcaneus. Talus calcaneus. The other ankle bones you only have to know as tarsals. You have carpals of the wrist. You have tarsals of the ankle.
Toes.
Tarsals close to the toes. Cool. All right. Tarsals. You had carpals and metacarpals of the palm. You have tarsals and metatarsals of the sole. And then again, you have the phalanges of the toes. You have the distal, medial, and proximal phalanx, except for the big toe, where you have the distal and the proximal. Right? Again, start at the girdle and work your way down. You could just spend just a little time, first you spend some quality time with the coxal bone, just learning ilium, ischium, pubic. Right? Iliac crest, acetabulum, my instructor, foramen, greater sciatic notch. Right? And just do that a few times. Right? And then add maybe the proximal end of the femur. And then add the whole thing. Right? Then add the tibia. Add on, just adding a little. Right? That repetition, before you know it, you'll know it all.
Did your model owe money?
What?
Did your model owe somebody money? They shot his kneecaps off.
Just patella.
Everyone's a critic.
I also think tibia true, tibia false, or fake.
Yeah, keep a line
All right.
away from you.
There it is.
The
What's
patella.
that? Keep
All right,
Lies
Abby?
away from you.
Ah.
Yeah.
Are you looking at me? Are you looking at me? Did you lay my bones out? Did you bring me here? All right. Okay. So, suggestion to you is, get into your groups, right? There are articulated skeletons throughout the lab, and you have the boxes of the disarticulated skeleton. Use them as guides to help you go through this process. One thing I should bring your attention, which I didn't, right, yet, and that is differences between the male and female pelvis. The male pelvis tends to be more dense and hard compared to the female pelvis, and that's basically because the male pelvis reacts to the stresses put on it by the muscles, and men tend to be, have more musculature, right? But if you look at the the differences in how broad the female pelvis is versus the male pelvis, right? You can see it's lighter and it's also more broad, right? This opening here is larger, right, to facilitate birthing, right? Because the fetus has to go through, right? If you look specifically at the pubic arch, in women it's greater than 90 degrees, and in men it's less than 9 degrees, right? And the older men get, right, it tends to get even smaller, right? Because especially married men, because the more they're nagged, the smaller.
Oh.
Just a little humor there. Edit that out. Just a little humor. Right? So you can look. An easy way to identify a skeleton as male or female is just to look at the pelvis. Right? You can look at this one.
Angle.
Right? You can tell it's what would you say? This is a little harder, right?
That's male.
Right. It is a male. If you look at that one, you can identify it fairly easily. But that's
a young girl.
Female.
She looks thrown in there.
What about the one in the back?
Well, no, I don't think it's.
And that's a real one. That's a real skeleton, by the way. We also have some painted bones here, right? So if you want to get a better picture of where does the iliac bone end, where does the ischium begin and end, where does the pubic bone begin and end, right? We've got some painted bones here that help you identify beginning and ending of various bones and bone features. Okay? All right, so hopefully this was worth the time taking out.
Oh, yeah.
Cool. And if anybody wants to use this articulated skeleton, you're welcome to do it.